as well as abroad. I invite Dr. Bhavin Chirkania to proceed with his presentation.
Thanks, Professor Sharma, and I'd like to thank Professor Lokhande and Professor Berde for giving me this opportunity to come here. But I'm pretty much a complete fish out of water right now. So, just to understand, if I have an audience, how many of you are from the field of medicine? Okay, so at least about 20% of the people here. And as Professor Halls was saying, I am going to address this lecture to the non-medical crowd. So all of you who understand medical words better, you just have to bear with this. You can just assume that you're undergoing some kind of a kindergarten exercise to kind of refresh whatever you might have learned in the past. When we talk about radiology, and I kept asking Rakesh, and I've known him for many years, as to why did they invite a clinical medicine person to a conference on convergence and nanotechnology. And his answer was the convergence part. And when I started thinking about it, the question that everybody would first have is, what is radiology? And radiology is a field that creates images of the body, different body parts for diagnosis and management. But we use specific tools to do that. And what are the tools that we use? Probably the most common even today is the X-ray machine. The X-ray machine essentially throws out X-rays that go through the body parts, and we get an image like this. And we call it a radiograph. We look at it and we make a diagnosis. However, while the technology is used by doctors, the person who created the technology, or who discovered X-rays and then laid the path for the invention of these X-ray machines, was not a medical doctor. And he was a doctor, Dr. Wilhelm Conrad Röntgen. We celebrated the International Day of Radiology yesterday, which is essentially his birthday, and he won the Nobel Prize in 1901 for this. And he was essentially a physicist, right, who did something that changed the practice of medicine forever, right? It was a huge paradigm shift to be able to see the lungs and the bones and the insides of the body. Now, taking this ahead, so for almost a century, or at least 80-90 years, X-rays ruled the roost. And then somewhere in the late 1960s, there were some researchers out of England who tried to figure out whether these X-rays could be used better to create images within the body that would allow us to look at soft tissues. Many of you would realize that when we have X-rays like this, all that we can see are high contrast structures like the ribs and the lungs, but within the heart that you see here, I can't differentiate the chambers of the heart, etc. And in 1969, Godfrey Hounsfield and his colleague Alan McCormick, invented the first CT scanner for a company called EMI. And Godfrey Hounsfield was an electrical engineer. He won the Nobel Prize for this in 1979. The CT scans are done by us, interpreted by us, but the person who was responsible for it was not a medical doctor, but an electrical engineer. A lot of the work we do with nuclear medicine, with positron emission tomography, owes a huge debt to Marie Curie, and she obviously won 2 Nobel Prizes, one for physics in 1903, one for chemistry in 1911. Unfortunately died of the ill effects of radiation because she wasn't aware, despite all her intelligence, that radiation could be harmful in large doses. But today, PET-CT has completely revolutionized the field of oncology, right from diagnosis to treatment monitoring. Again, everything that we do is done by clinical doctors, but we owe a debt to a physics and a chemistry professor. The other modality we use, and we will talk about this today, is MR. And MRI uses protons within our body that are aligned in different ways using powerful magnets to generate images like these that allow us to differentiate grey from white matter in the brain and various different body parts across all organ systems. And again, while contentious, there were many people who were involved in the invention of the MRI machine, but the Nobel Prize went to Professor Paul Lothar, again, not a medical doctor, but he was responsible for creating an instrument that has again completely revolutionized what we do. Ultrasound is again an extremely common modality. We see images in black and white. We can use Doppler effects to create color Doppler images. And this was an extension of the use of sonar that was used by the submarines during World War II to find objects within the sea, and then that eventually translated into the first ultrasound machines in the 50s and 60s, and then today, of course, you can have an ultrasound machine on your iPhone, and that's the kind of technology that we're dealing with. So that's as far as the convergence is concerned, right? All of us who today have either visited doctors or are doctors will not go away without some test that involves one of these modalities. These modalities were created by physicists, engineers, and chemists, right? That is the power of convergence. What we owe today are debts to people who made these machines, and then we use them for the benefit of society. So what is radiology's goal? It is to be able to solve problems and give answers to clinical questions. And this is done primarily using structural evaluation. And I'll give you one example of what we do on a day-to-day basis routinely. So here's an 18-year-old pediatrician's daughter who came with cough and expectoration. And she had a radiograph that showed some abnormality here, the white stuff that you see here, which he interpreted as tuberculosis. He made two mistakes. One, a pediatrician should stop treating people who are above the age of 12, and a doctor should never treat his own child, right? So two huge mistakes, and he landed up giving treatment. Eventually this shadow increased, so then he became extremely frantic, and this only happens in India. So he went to his brother-in-law who has a CT scan center, and they found this abnormality here, which the brother-in-law thought was cancer. Then they went to a thoracic surgeon who had already made the diagnosis, called me and said, Bhavin, can you do something to prove the diagnosis? And I said, I'll repeat this CT scan better because I know what we're looking for. He said, you can't do that because if you do that, the pediatrician will think that his brother-in-law is not a good radiologist, and therefore can you do something else? And so we did an MRI. When we did the MRI, we also gave a dye injection, we did an angiogram, and the diagnosis in this case is a congenital anomaly called sequence.